This presentation is brought to you by Brain Core Therapy. When does a constant feeling of being achy and tired crossing the line into something serious? At this point, you want to ask yourself, what are the signs of fibromyalgia? It's important to understand and recognize these symptoms as fast as possible. Fibromyalgia is a chronic pain disorder that causes lasting, debilitating pain and tenderness all over a person's body. It can be more or less intense at different times, but it has a major negative effect on more than 5 million Americans who suffer from it. There are some other syndromes and disorders that share commonalities with fibromyalgia, including myofascial pain syndrome. Patients sometimes have to wait months or even years and undergo an endless series of tests and dead-end road treatments before a doctor finally recognizes the signs of fibromyalgia. Even after diagnosis, different people respond in very unique ways to different treatments. Here's a quick list of some of the signs to look for. There's fatigue, general pain, physiological symptoms, and post-traumatic stress disorder. Now, everyone gets tired, but people suffering from fibromyalgia can be very well rested and still feel exhausted, drawn out, and stretched way too thin. People with other commonly confused disorders like myofascial pain syndrome generally don't experience the same levels of general pervasive fatigue when they're well rested and their pain is under control. Sometimes people with fibromyalgia are diagnosed with lupus, rheumatism, or other autoimmune disorders that causes chronic pain. But fibromyalgia is not specifically joint pain, and in fact doesn't cause a specific pain at all. It causes pain and tenderness all over one's body. Though people showing signs of fibromyalgia suffer psychological effects from their sleep loss and chronic pain, those effects are results, not causes of their disorder. With other disorders that have overlap with fibromyalgia, such as multiple sclerosis, the symptoms are primarily neurological, though they are often accompanied by physical problems as well. Scientific studies have established a definitive link between post-traumatic stress disorder, which is most famously experienced by soldiers who fought overseas, but is surprisingly common in civilians who have experienced traumatic events in the course of their normal lives. Not everyone who has fibromyalgia is suffering from PTSD and vice versa, but there is definitely a connection that medical researchers are still trying to identify. Though other commonly confused disorders like MS and lupus are also somewhat more common in women than men, it is undeniable that 80 to 90% of patients who present signs of fibromyalgia are female. If you think you may be suffering from fibromyalgia, you are not alone. It is an extraordinarily common malady that affects more than 1% of the population. Speak with your doctor today. And although there is no cure, there are many therapies and treatments available. For more information or to schedule a consultation with your local Brain Core clinic, please visit our website at www.braincoretherapy.com.